This is the final part of the series. Panel at a glance. Manny Garcia Lassie, 42. Doctoral student at the City University of New York's Health Psychology and Clinical Science program. Diagnosed with depression at 29, Bianca Thompson, 30. Certified nursing assistant in Oklahoma City. Diagnosed with depression at 19, Sarah, not her real name, 30, content strategist for a book publisher in New York City. Diagnosed with depression at 14, Jacob Apple, MD. Psychiatrist and assistant professor of psychiatry at the Icahn School of Medicine at Mount Sinai in New York City. Becky Whetstone, Ph.D. Licensed psychotherapist in private practice in Little Rock, Arkansas. Part 6, The Biggest Depression Breakthrough. SQ, what has been your biggest breakthrough in managing depression so far? Bianca, the day I started to become an active participant in my recovery was the day that this uphill climb became easier. When I started asking questions about my options, voicing my opinions and preferences for treatment, and listening to those who told me I'm worth fighting for and that I'm not alone in this, that's when the worst became much easier to endure. It helped me realize that there is sun on the other side of this dark cloud I carry inside myself. Sarah, the biggest breakthrough I've had is that I actually did get better. Not 100% of the time, I feel that it's more accurate to say I'm in remission. Because when you live with depression for so long, it becomes a part of you and your personality. Even with a treatment plan, I don't feel cured of being depressed, just better at handling it and getting by. But there are days when I can go outside and I'm actually excited for my future and feel content with my life. Every day isn't as much of a struggle as it used to be, and that is something of a small miracle. Honey, hands down, training as a therapist has been my biggest breakthrough in managing depression. My first clinical supervisor said it's best to be 10 steps ahead of your clients, not 100. That approach to therapy, that we're sharing in this human journey rather than me speaking at them from some mythical place of perfect health, has helped me embrace the idea that health is a continuum, so I can embrace my progress and use it to help others. Having enough personal health to help others heal was a very important milestone for me. I learned so much from each client. Their courage and strength and trust inspire and motivate me to be better and better. Our reliance on honesty, gratitude, and humor is deeply meaningful. Expert perspectives. Apple, 2 major realizations have helped some of my patients manage their depression. The first is the acceptance that major depression is actually a disease, not a reflection of an individual's resolve or willpower or moral worth. Closely related to that is the realization that a patient needs consistent treatment to overcome this illness, that skipping a dose of an antidepressant twice a week makes no more sense than skipping doses of chemotherapy. The second major breakthrough occurs when patients overcome the shame many feel about their condition. When my patients have been able to tell their loved ones about their suffering, I've witnessed significant improvement in both short-term symptoms and long-term adherence to treatment. Dr. Whetstone, I've seen drastic changes in a short time when a person commits to a treatment plan of therapy and, possibly, medication. A good therapist can teach you how to process information in a healthier way. Many times a bad habit of negative thinking keeps us mired in depression, or we have certain perceptions that are totally off, and it makes a big difference when they can be corrected. There are so many tools in a therapist's toolbox, so when your therapist makes suggestions, I recommend actually doing the work. My clients who read the books I ask them to, do the homework I assign, and come to therapy regularly get better so much faster than the ones who don't. Start over. Part 1. What major depression feels like.